Hello everyone, my name is Victoria Cerda. I'm a current third-year resident at Cedars Sinai. This will be a descriptive analysis on cervical adenocarcinoma, factors and outcomes in early-stage patients. Cervical adenocarcinoma and adenosquamous carcinoma comprise nearly 15% of all cervical malignancies in developed countries. However, they are associated with a lower 5-year survival rate. There is limited research regarding adenocarcinoma and adenosquamous carcinoma incidence, risk factors for worse prognosis, and treatment modalities. Is particularly sparse in regards to HPV status, both among non-metastatic and metastatic patients. So let's take a look at some of the descriptive analysis. This is a retrospective analysis. Inclusion criteria included women greater than or equal to 18 years old with cervical adenocarcinoma or adenosquamous carcinoma between 2006 and 2020 and with the appropriate documentation. Exclusion criteria were women less than 18 years old, anyone missing information, or lost to follow-up. Pearson's chi-square was used for differences between categorical variables. As you can see in the table, the median age at diagnosis was 45 years old. 70% of women identified as white, 90% were diagnosed with adenocarcinoma, 74% were stage 1, 40% were of moderate grade, 56% were HPV positive, 63% had no lymphovascular space invasion, and a majority at 57% had tumor sizes less than 2 centimeters. Looking at women with metastasis, the median age did not differ. When looking at factors that impacted recurrence, lymphovascular space invasion, depth of invasion, tumor size being greater than 2 centimeters, and oophorectomy were all significant. HPV status, type of surgery, and tumor grade were not significant. Survival analysis could not be performed as greater than 90% of the cohort is still living. Our cervical adenocarcinoma population was diagnosed at a younger age and earlier stage compared to other populations. This may possibly be attributed to a specific population with increased access to screening, therefore conferring better prognosis. Now, due to the small group of patients with metastasis, we were unable to perform comparative analysis among this group, therefore indicating need for continued data collection. Of greater note, a significant amount of patients were excluded due to missing HPV status, as HPV status and presence of high-risk strains have been observed more in younger patients, and some studies have alluded to the absence of HPV having a worse prognosis. This study serves as a reminder to ensure diligent reporting for cervical cancer specimens, particularly in light of advances in immunotherapy approach. Here are my references. Thank you. I would appreciate any feedback or questions.